If you're a health professional or personal trainer or health coach, then I welcome you to MyMT education. This is an offshoot of the Menopause Transformation programs, and over the past year I had so many practitioners asking me to develop some courses and to really help them understand some of the lifestyle science solutions that they need to be advising their clients on who are in this wonderful age and stage of life called menopause. There are 3 stages to menopause: perimenopause, menopause, and postmenopause. And one of the things that I'm always doing is thinking about those postmenopause years. That is the purpose of our menopause transition. Just as, you know, puberty was a transition into our reproductive years. So that's what I'm always saying, is that menopause is the bookend to puberty, and what we need to be doing is thinking about the fact that what is happening to the decline in hormones is that we're getting set up for our aging years ahead. Now, never before have there been so many women living longer lives and certainly a lot more interested in how they can age well. And what's really important is that that trajectory starts during the menopause years. So if women aren't changing their diet, their exercise, if they're not sleeping, if they've already got underlying health problems, then they need the support to be able to understand, first of all, why they need to change their lifestyle, how to change their lifestyle, and most importantly, they need support to do that. And that's where you come in. I'm Dr. Wendy Sweet from MyMenopause Transformation, along with my daughter Georgia Sweet, who's the course convener for the MyMT education. I have a fabulous continuing professional development program for health professionals over the past year that has been booked out really quickly, and I've had nutritionists, doctors, physios, you know, therapists, women who are, or practitioners who are working with midlife women and want to dive deeper into the physiology. I've had many years teaching physiology at university level, but most importantly, what I'm trying to help the practitioners do is understand that women are aging. And I'm carrying my Theories of Aging handbook here. And I'm often dipping into this, and I teach women about how to really understand that menopause is the biological gateway to our aging years. And once we understand some of these theories of aging, then we can think about their lifestyle, we can think about what's going on, about, you know, how to move them into the evidence behind the lifestyle science that is now specific to the menopause transition. For example, the gut microbiome is really important for women. It changes as women come through their menopause years, as do the muscles, as does the liver and our blood vessels. So all of these areas are a focus of my attention, and that's what I also bring to you in the Continuing Professional Development course. There's information on the website, there's the course outline, and for those of you who don't want the commitment of the 12-week course, or you're not a registered practitioner and you're a personal trainer and or you're a health coach, then I want you to look at the brand new Menopause Weight Loss Coach course. Now, some of you health coaches might not have exercise prescription in your scope of practice, but you can do the course for your own interest and to be able to kind of think about a little bit about some of the physiology of menopause weight loss. I take you on a deep dive into the physiology of weight loss for women that is specific to menopause. We go through some of the nutrition. We certainly go through exercise prescription. And for those of you who are personal trainers, I really want you to understand cardiovascular health and how that changes as women age and come through their menopause transition. The liver is really important, and so are the muscles. So that's the Menopause Weight Loss Coach course. I've got which is 6 weeks. Now that one's self-learning, so you don't interface with me. You just get on with it, you do it. There's a bit of a quiz. There's all these self-learning questions at the end. And for those of you doing the 12-week continuing professional development course, then, you know, that's a bit more expensive because you interface with me. So we have our Zoom calls, and you've got a case study to do that I look at as well. So I've got my education hat back on in 2023. I'm going to take you through a lot of the theories around women's health, women's aging. I'm going to help you understand why, I'm just bending down to get this other book, why the evidence around the Mediterranean diet is absolutely crucial to your practice. And I really am going to help you succeed with understanding this particular phase of life for women who you're seeing at the coalface, so that you can have much more insight and advice about some of the lifestyle science that is now available as evidence that we need to be educating our clients about. I'm Dr. Wendy Sweet from MyMenopause Transformation. My doctoral studies were in women's health and aging. I've positioned menopause in the aging science and certainly the lifestyle science as well. Doesn't matter what medications, you know, women are on. I don't interfere with that. That's between them and their doctor. But what I want to do is help you to think about how you can help your clients to understand the lifestyle science as well. So pop to the website. There's a link which is CPD courses, and you can read about those. There's also the 6-week menopause weight loss coach course. So if you're working with midlife women, and who isn't, you know, worried about their weight gain as they come through this life stage, then that course is for you as well. I can't wait to share the knowledge with you that I've been accumulating for so many years, and it brings, you know, it really helps me to help you to bring that to your attention, so that together and collectively we can help women around the world feel better and age well.